thank you, Sharon, so much for being on the show. I'm so excited to talk to you today.
Thanks, Robin. This is a subject that I just love, nutrition and aging, so I am thrilled to be here with you today.
Well, this is wonderful. And Sharon and I know each other through the Senior Home Coach programs. So we've talked about that here on the show from time to time. And Sharon, why don't you give people a little bit about your background? We are going to talk about nutrition and just kind of healthy aging today. And so why don't you give us a little bit about your background and your education regarding that?
Okay, so I have a bachelor's and master's in nutrition and a Ph.D. in epidemiology. I taught nutrition and epidemiology in colleges and universities. I worked as a dietitian. I've done real
All the
estate
things.
done real estate for the last 20 years, concentrating on seniors, and then recently became a member of the Senior Home Coach movement. And then I joined Compass Plus, which is the senior division of Compass Realty. So,
Excellent. In today's world, older adults face major transitions like downsizing, relocating, or modifying their homes to age in place, all while embracing life after these changes. As a senior home advisor and seasoned realtor, Robin McCoy guides these decisions with care and thoughtful planning, helping create a vibrant future. Welcome to Relax, I Got This, Embracing Life After 60 with me, your host, Robin McCoy. You've been in this space for the majority, pretty much all of your career, of your career in one aspect or another. And what have you found when it comes to, as we get older, 60s, 70s, 80s, etc., what have you found when it comes to like our nutrition and our overall general health? What have you seen?
well, I think people are not healthy in general. If you
Yeah.
figure the many aspects of health are not just the absence of disease, but also social and mental health. So as you get older, I remember my mother-in-law telling me this. I said, what does it feel getting older? And she said, well, I've lost all my friends.
Yeah.
So,
Yeah.
I mean, that's a pretty good sign. Like, as you get older, your social interaction lessens. If you are living alone, then you tend not to eat as well because I've asked lots of older people and I said, what's it like cooking for one? They said, I hate it. They hate it. They just don't like
They
doing
hate
it.
it. They don't like to. They've been
They hate it.
cooking for, families for their whole life. And now it's just like, well, it's just me. Why do I make all of this? And then I end up throwing it away.
Right. Right. Or they don't like to cook. They don't like the whole
Yeah.
process of cooking. They don't like to
You
shop.
know,
They don't like to cook.
well, and it's harder for them. My mother, and I talk about my mom a lot on this show. In 2023, when she went into the hospital, the doctor came in and looked her dead in the face and said, "You not undernourished, you are malnourished.
Oh,
Not undernourished, malnourished." And she was absolutely astounded because you think of when somebody is malnourished that they're thin and weak and sickly and all those things, and she's none of that.
right. Right. So I wonder what he based his decision on. But typically, what happens as people age, they lose their muscle mass and their bones weaken.
Mm-hmm.
Okay. Which is attributable to quite a bit of the falls that occur among the elderly, too. But, and they're typically deficient in the B vitamins only because they tend not to eat as many fruits and vegetables, that's where a lot of the B vitamins are. So,
Right.
those are the two. The main problem is protein, which helps with the muscle and the bone, and then also with the B vitamins. And the other thing is they tend to gain weight. I
Yeah.
don't know if your mother was malnourished and heavy, but what happens is that as you get older, unfortunately, your energy needs decrease dramatically. One, because your energy just to run your body decreases, but also your activity level
Yeah.
decreases as you get older. So, and they tend to eat either the same amount of food that they used to eat, or they eat what I call empty calorie foods, which are the foods that don't have any nutrients in it, like what everybody snacks on. Like they get hungry, they eat something quickly, like potato chips and cookies and crackers and all sorts of things.
Yeah.
So,
Well, and that's where my mom was, right? She was cooking. She would get up and make a can of soup or a sandwich or something frozen And that's all, there's no nutrition in any of that.
Right. No, nothing. Nothing.
So what would, when we've got people that are living alone, they're independent, they're fine, there's no comorbidities or any of these things they're fine, but yet they're not eating well. What should they be focusing on? What are things that they can focus on that, one, satisfies that I don't want to cook, but also, maintains their health and their energy levels?
It's wise food choices. So
Okay.
they need to have protein in their diet. I can't emphasize that enough, that protein is extremely important for someone that's aging. So they need to have good protein sources like fish, eggs, meat. If they don't eat meat, then there are beans and lentils that they can eat. But pretty much protein, to start with the protein part of your diet first, and then include other nutrient dense foods. That's the whole thing, is learning what a nutrient dense food is versus an empty calorie food. So I'll give you an example of a nutrient dense food that doesn't have many calories, as a fruit or vegetable. They are
Right.
loaded with nutrients and low in calories. So if they want to grab something, let them grab a plum or an apple or a carrot, you know?
Eat a
So
carrot. So a salad. It
a
can be
salad.
filling. It can be filling, and it's got all those vegetables in it.
Right. Right. And I think the other thing is to have convenience foods that are nutritious ready for you, because that's the biggest thing. People do impulse eating. Okay.
Right.
So, like, have hummus in your refrigerator and carrots and, I don't know, guacamole, something like that. Have cheese available. Have foods available that you can grab quickly rather than go reaching for the snacks. So,
Yeah, I think, and that goes across the board, whether you're,
right.
40 or 80, right? I think we've
Or
gotten
10.
into
Or
or
10.
10, or 10.
It doesn't matter. The other
Yeah,
little tip is, like, don't go to a food store hungry. You know,
yeah.
if you go to a food store hungry, you tend to go to the aisles that will immediately please you with, like, snacks and processed foods. But if you're fed and go to the store with a shopping list, you will buy what you're supposed to buy.
Well, so let's talk about nutrition a little bit, and why some of that is so important. How does it, I mean, it prevents disease, it maintains your bones and your muscles. Let's talk a little bit about those essential components of nutrients and what that's going to do for you in the long term.
So there are lots and lots of nutrients. We could spend hours, months, whatever, talking about it. I used to teach a whole course in nutrition that went over 15 weeks. So in 30 minutes, I'll tell you, there are the three macronutrients, which are protein, carbohydrates, and fats.
Right?
Okay. They're all the ones that produce calories. There's another one that produces calories, but we don't call it a nutrient, which is alcohol. So proteins and carbohydrates supply 4 calories for a gram that's in the food. Fats provide 9, which is like almost 2.5 times the amount, and alcohol provides 7 calories per gram. So you can eat fatty foods and alcohol and sustain yourself, but they have no nutrients.
Yeah.
Okay.
I was going to say,
Then
so
there are
why, how's that going to work, right? And that's
like,
how it's
right,
got the calories you need, because we need calories.
right, but you need a lot less than you used to.
Yeah. Yeah.
That's hard to imagine. So you're exercising less. Your metabolism, for just breathing and working all your organs is less. So you don't need as much. So we're probably talking about, I think basal metabolism goes down like maybe 2 to 5% a year after the age of 50. That's the energy just to work your body. And activity levels, some people have no activities. They're completely
Yeah.
sedentary.
Yeah.
So there it is. That's all it is. So,
Well, and so, I think sometimes people, and I think too, we don't get as hungry when we get older, right? It's like, I'm not that hungry. Is
I
that
think
is that true,
that's
or is
almost,
that a misnomer?
I think that's, well, I'm getting older and I'm not that hungry. I mean, I'm hungry, but I eat. I mean, I still eat.
Yeah.
I would say it's more the social thing about eating. It's boring eating alone. Okay. So if you go out when you were younger and you go out with your friends and they're ordering all these different types of foods, you tend to eat a lot of food when you're out and for a longer period of time because you're engaging in social activity. When you're isolated, which you may be when you're older, even if it's just you and your husband, then you have less conversation. You just eat to eat.
Right? Because you know you're supposed to.
Right. You're supposed to. Right. 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 Now, you don't have to eat 3 meals a day. You can eat small meals during the day. I think that would help a lot of people too. If you're
Right.
hungry in the morning, you have half a sandwich. You don't have to eat breakfast foods for breakfast. You can eat half a sandwich or whatever. So,
I know we get stuck in those traditional roles too, right? That you have to
right.
have bacon and eggs, or you have to have a sandwich at lunch, and you got to have this big 3-course meal at dinner.
Mm-hmm.
And and I had a statistic, and I'm going to say it's like over 50% of people 70 and older are undernourished.
They're also obese. So, as about 40% of the adult population is obese. Isn't that amazing to you?
Yeah,
Almost
yeah.
half the adult population is obese. And if they're undernourished, it's not because they're not getting enough food, they're just getting the wrong kinds of food. Or they're not moving. That's the other.
I think it's probably a combination of that, right?
Yeah,
That
combination of
they're
things.
not
Yes.
they're not exercising, and so therefore they're tired and they have low energy, so therefore they don't want to cook, so therefore they're eating the wrong foods because they're going convenience and simplicity versus intentional, I guess.
Right. And I've noticed a lot of older people, like in congregate eating, like if it's a church or someplace else, they'll head for the desserts. That's what they head for. They love the desserts. They may
Because they're
not keep
made
it in
by
their
good Southern Christian women and they're very good. I mean, banana pudding, for heaven's sakes, it's the best. That's the way I look at it.
You asked me a question about what do nutrients do? Nutrients do a
Yeah.
lot. Okay. So I talked about the three energy producing ones, and then there's the vitamins and minerals, which really minerals have been known for centuries, but their a function in the human body has only been known for probably 100 years. Okay. And vitamins are only about 100 years we've known about vitamins. I mean, isn't that amazing?
Yeah, yeah, it feels like it's
So
been always.
right, right. And, well, for us, it is always. It's our
We're
lifetime.
not quite 100 years old, so.
Right. So I'll give you an example. So there used to be this disease called pernicious anemia, which is caused by a vitamin 12 deficiency. Okay, people were dying of it. Pernicious means dangerous, and that's what it was, dangerous anemia. And the way they treated it was with feeding people raw liver. I mean, can you imagine that? Because they
That
didn't
sounds
know that there
terrible.
was such a thing as a B vitamin, right?
Yeah.
Yeah. Yeah. So we're pretty we should be grateful that we know about the vitamins and the minerals. We just don't know where you get them from. So a lot of people resort on supplements, which you shouldn't have to. If you eat I keep going back to this, nutrient dense diet with lots of fruits and vegetables, you will not have a problem. You don't have to take supplements, or you don't have to take as many supplements as you do. So, okay, what do the nutrients do? Well, we talked about it. They maintain bone and muscle health, which is extremely important. The nutrients that are involved in that are protein, calcium, vitamin D, and magnesium. Okay. And they're found in the high protein foods. Vitamin D is found in the dairy products. And magnesium, sometimes people have to take a supplement for magnesium because it's hard to
Yeah,
find
that's
in
a
foods.
big thing now, right? People not getting enough magnesium.
Right. So the magnesium supplement that's good for muscles and muscle cramps, to prevent them is magnesium glycinate. There's all different kinds of magnesiums, but that's the good one. Maintaining and managing chronic diseases. Well, we all know that fiber is important, antioxidants are important, and there's omega-3 fatty acids, which are the good fats, okay, like in
Yeah.
olive oil and avocado oil. Promoting digestive health. Water. Water is probably the most essential nutrient. The
We
common
don't
side
drink
effects
enough,
of
nowhere near
water
enough
is
water.
dehydration. Seriously, dehydration. And it
Yeah.
doesn't have to be water as water. It can be water containing foods, it can be water containing drinks. As long as it doesn't have too much caffeine in it, then you can just get enough of your water intake. So you don't have to drink, I don't know, 8 quarts of water a day. You can get things from your food supply. Like, Fruits have a lot of water. Watermelon,
Yeah.
obviously,
Yeah.
cantaloupe, all these kind of things.
Yeah.
Enhancing energy and mood. Well, those are like the B vitamins. And of course, sugar, you need some sugar in your body because your brain works on glucose. So you need to have some sugar source, but just don't overdo it. Boosting immune function. That's extremely important, like
That's
vitamin
huge.
C and zinc, vitamin D and protein are good for that. Controlling inflammation, which is like the cause of most diseases now, is inflammation. So if you control it, that's good. And that's like eating, like turmeric. You know what that is? Like that thing you put
Mm-hmm.
on food. Olive oil is good, and then other omega-3 fatty acid containing foods like salmon, sardines, those kinds of things. And then nourishing the brain. Well, those are antioxidants, omega-3 fatty acids, and then some of the B vitamins. So they're all important. And you asked about deficiencies among seniors. The most common deficiencies are protein and B vitamins. So that's like almost all the functions that you have
Yeah.
to,
Yeah.
you know,
Right.
yeah.
That's what most people are most deficient in, and that's the two that are going to be the most beneficial to you
Yes,
for
yes,
your
yes.
overall, keeping things rolling, right?
Right,
Keeping
right,
things
right, right,
functioning.
right, right. So, I mean, that's it. I mean, and I don't know whether, I mean, I know if you go into like a senior living option, you have food cooked for you, but a lot
Right.
of people don't eat the food or don't like the food or whatever. They don't eat as much of the food that they need. So, there are still deficiencies. The same deficiencies are found in senior living places too. Maybe not as extensive, but they're found there too. Protein
Well,
and B
and I'll
vitamins.
tell you, because my mom is now in a residential care home and they are feeding her 3 meals a day that are home cooked meals,
Yes,
she is healthier than
that's good.
she's probably been in a long time. I mean, I think she's still got some deficiencies because to build that back up is a lot,
Right,
it's difficult. And yet, I can just tell by looking at her,
right.
that she is doing better because she's eating more regularly and more whole foods and not frozen and canned
Right.
meals.
And she's also socializing.
Yeah, yeah. She's got people that she's talking to and walking through. And I
Right.
think you brought that up is when people move into any kind of senior living environment,
Right.
sometimes say, well, I don't want to go eat with those people. I don't know them. But part of it, of the good nutrition and all of those things, is eating with other people. The socialization part of our overall mental and physical health.
Yes,
So,
absolutely.
so now let's talk about how we might be able, a senior, there's different ways to make it easier, right? Make it easier in getting meals, like, home delivery services,
Right.
right? Maybe some food prep companies that bring pre-made good nutritious meals into the home for you. What are some of the ways that they can maybe utilize some different aspects out there that are there for them now?
Well, I think it all depends on their financial status. Okay.
Sure.
So they're not inexpensive, those food delivery systems. Okay.
No.
Even if you had food picked up at the store for you, or Walmart would deliver the food for you, or Instacart would deliver the food for you, there's a fee associated with all of the services that you get.
Yeah.
Okay. The other thing is that the more prepared the food is, the more expensive it is. So if you can get the ones that are prepackaged in the meals, okay, they're more expensive. They're good. They probably have all the nutrients that you need in it. And the other thing is something like Hungry Root, which gives you the ingredients for each of your meals, and you have to make it though. That's the only
Right.
problem.
Right.
Yeah. And then there are programs. There's lots of social programs to feed people. Obviously, everybody knows about Meals on Wheels.
Right.
There are also congregate feeding programs. Some of the councils of aging in different areas around the country have congregate feeding programs. I've looked at their food. It doesn't seem very healthy to me, but you know.
But maybe it's better than what they're feeding themselves at home, right?
Right. And it gets them out. So that's good too.
Yeah.
I mean, I just have this case where I'm going to meet a man and his wife who are in their 90s, and he says to me, I need to tell you that we've outlived our money. That's a very
It's a
sad
crisis.
thing.
And it's a
It's
crisis. And
very
it's,
sad. And how do you provide services to someone that doesn't have any money to provide to pay for them?
yeah. Yeah. It's very challenging, and I think it's a crisis in this country. Is
Mhm.
we have seniors that have outlived their money. They feel like they can't, you know, move into a situation or provide for themselves in a way that will keep them healthy and in their
Right.
homes. It's just this, I think it's very cyclical. And and we need to make people aware of what they can do to keep themselves healthy for the long term. So starting early, like you said, 10, 20, 30, 40s, eating right and eating well now so that, in the future.
Right. My daughter-in-law, she has a 6-year-old, 7-year-old, and a 13-year-old, and she has been feeding them healthy food since they've been infants.
Yeah,
It's a challenge. They want to eat what all their other friends are eating,
sure.
and they have birthday parties and things like that, which she allows them to eat the stuff there. But she is very concerned about what they eat.
Well, and I think that's, we need to look at our aging parents, if we're fortunate enough to still have them with us, and making sure that, that they are, taking care of themselves nutritionally,
Right.
and what could maybe the kids do, the adult children, as they're watching their aging parents, what can we do? I think I could have done things a little bit differently regarding my mom in the last 10 or 15 years. What do you think that we can do to just help our parents age healthfully? Healthfully.
I think advice is always good. It's sometimes hard to give your parents advice because they're the ones that used to give you the advice. If you live close enough, you can actually invite them over or pick them up to bring them to your house to give them a home cooked meal.
Yeah.
If You could bring food to them that is home cooked and let them do it. I don't know. It's harder when you live across the country
Sure.
to do them. Uh, so,
Yeah.
I
Well,
think
and I
it's just
think
like,
too, you mentioned, some of these communities have, I don't remember what you called it, but the community meal programs, right? Where maybe you go to the senior community center in your town and they have luncheons and they have, events in those, if you can get there, right? You've still got to be able to get there, but there's transportation services as well that would then take you to the community center. They're having a lunch. You get the social, you're out of the house, you're moving around, you're getting a full meal, and accessing some of those community benefits that are out there.
right. There are some religious organizations that have services for like homebound congregants of theirs where they have a sick list and they find out who's homebound and then they have volunteers deliver food to their home. So there's all sorts of programs, but I think the big thing is to, even if you are long distance from your parents, keep in touch with them, ask questions about how they're eating, ask what kind of foods they're eating, maybe visit them sometimes and buy them foods that they could eat, that they could keep in their refrigerator, or their
Yeah,
pantry.
I think it's, when I was in college and I would come home for the weekend, my mother, every time she had made a meal for the rest of the family, she always put a serving aside for me and put it in the freezer. So I had my own little, frozen dinners when I got back to school, right? And everybody was jealous, right? Because everybody else was eating, poor college student food. And I had good meals because my mom always set one aside. So maybe do that if you can, if it's
Right.
conducive to where you are with your parents, is when you make a meal for the family. Just take one and freeze it so mom and dad can cook it easily, but you know what's in it. It's not full of preservatives and not full of sugar and things that aren't going, to benefit them.
Right. Yeah, absolutely.
We Are One Heart is a 501c3 nonprofit organization dedicated to bridging the gap between the needs and resources of low-income seniors and veterans. Rooted in compassion and love, our mission is to provide housing, living assistance, and access to critical resources that ensure dignity and support for the elderly in underserved communities. At the heart of We Are One Heart's work is the belief that every individual shares a common humanity, a heart connected through love and care. We are committed to creating a future that honors those who have shaped the past by offering programs and services that enhance their quality of life. For more information or to donate, visit wa1h.org. That's wa1h.org. So, somebody that maybe doesn't know all this stuff, right? We know about vitamins. Are supplements really, we hear about supplements and vitamins. Well, I take a multivitamin every day. Are those going to be helpful?
Yeah. I don't think you need a multivitamin, but there are, I have this caveat I always say. You need to ask your either registered dietitian or doctor for what kind of supplements you need, because it all based on sort of what your body's doing. If it's depleted in certain nutrients, they should be able to tell from most blood tests.
Right.
If you're like deficient in iron, then you should eat iron-containing foods. If you're deficient in calcium, then you should concentrate on your calcium. Most of those things are measured routinely. You just have to go to the doctor to measure them for you.
Yeah, and I would say ask questions. Make sure that you're going to the physician that will take the time to explain this to you. They won't just send you the results of a blood test and let you fend for yourself on that. Right? Once we get onto Medicare and once we get older, sometimes we just go once a year for our wellness visit. They say, okay, and they check some boxes that you went, you get a report, and then you go back and see them next year. Learn to ask questions about that report, because as you said, they'll tell you if you're deficient in protein or calcium or any of your B vitamins. Learning how to understand that and ask questions.
Right. And they can look at you and see, just like the surgeon came in and saw your mother. If you routinely go to a physician, they will be able to tell you earlier than at the point you're malnourished that there's something going on. So.
Yeah, that's one of the errors that we made with my mother, is she went on we just did not have a good physician, and I didn't really learn how important that was until we were in moments of crisis. So, so many decisions are made in crisis, and we don't pay attention until we're in a critical place. So that's one of the reasons I do this show, is so that people can, listen to someone like you and say, okay, let's look at our numbers from our last blood test. And am I deficient in the important things? Protein, calcium, these B vitamins. To learn how to read that.
Right. Right. Or even if you don't know how to read it, that they should be able to interpret it for you.
Yes. And if they're not, go pick somebody else that is. Because unfortunately, there are doctors out there that just don't do that. They just don't.
Right. Well, what's blossoming around several areas, especially like in Texas, I think that's where you are, and Florida where I am, there are these senior primary care centers that the healthcare institutions are developing. They're doing it to keep people out of the hospital, which means they're keeping them healthier.
Yeah.
And they are, I switched to one of them, and I was amazed at the thoroughness that they ask questions and how long, and exams it's like an hour. The first visit was an hour. That's amazing.
Yeah, and we were taking her doctor. We were lucky we were there 5 minutes.
Right. Right.
Right. And so it's just so important to find the physician that is going to look at the whole you for the longevity of you.
Right. So if we go back to the original question, health is more than the absence of disease. So you have to be mentally and socially healthy in addition to being physiologically healthy. So nutrition, we talk a lot about eating, but it's actually the eating process is healthy for you. Socializing and being with other people when you eat is very important, not just for your physical health, but also for your mental health. So.
I think, we're in such a diet culture in the United States. Less calories, lose weight, be thin, skip a meal, We've got this diet culture that has become so ingrained in our brains that we think, oh, I shouldn't eat that, or that's too
Right.
much.
So I would say that we've spent the most on healthcare, and we are the least healthy nation.
Isn't that
The
crazy?
least. Of industrialized nations, we're the worst. It's pretty bad, isn't it?
It's
Well, most
bad.
of the issues are caused by trying to save people at the very end of their life with high technology. So that's sort of why the medical costs are so high. But if you look at a culture like Japan or the Mediterranean countries like Italy, their disease risk is much less. Their food is much different. So this whole trend now is to try to get seniors to eat a Mediterranean style diet, which high in, like, they use olive oil all the time. They use lots of vegetables. They concentrate on proteins. So it would be perfect for them, you know? It may
And
not be
people
in their
aren't used to
culture.
eating that. So then they're like, I don't like that food because they haven't, that's not what they grew up on or what they
Yeah, but who
spent.
doesn't like Italian food? You know anybody that doesn't
Oh,
like Italian?
I love it. I love it.
Right.
Olives are awesome, And I think we have to be careful about naming things good foods and bad foods. Obviously, there's great foods that are great for you, right? The proteins, the vegetables, all those things. But saying something is bad,
So there's some bad foods. I'll tell you some bad foods. So the bad foods are the processed foods. The
right?
processed foods are bad for you because they're high in preservatives, they're high in salt, they're usually high in sugar, and they have what are called these bad fats in them, like palm oil and cottonseed oil, and sometimes they hydrogenate them and make them worse. It's a mess. So it's bad. Okay, they're not good for you. And then there are all this new evidence about seed oil. So seed oils are probably all the oils that everybody uses. So other than avocado and olive oil, most of the oils should just be removed from your house, like canola, cottonseed, corn, safflower, sunflower, blah 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 blah. All
The
those.
generic vegetable oil.
Technical blah 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 blah, but that's
Blah blah.
really
That's well,
that's
because you
it.
walk in the grocery store and there's like 800 different kinds of
Too many.
oils, and you just need olive and or avocado oil.
Right. Well, olive oil is the best one, but avocado is second. If you don't like the taste of olive oil, then use avocado oil. I use a lot of avocado oil products now. There's a company
Yeah.
called Chosen Foods, and they have mayonnaise and dressing and, I don't know, vinaigrettes and a whole bunch of other stuff. So they're really good. They're
So
expensive,
it's
but they're good.
choosing. It's choosing wisely. I think too, when
Easy.
you eat better, you are it satisfies you more. So you probably eat better and eat less, but have a higher impact of nutrition.
Right. So,
Does that make sense?
yes, it makes total sense. Yes. I want to tell you before we conclude, I want to tell you about this food is medicine movement that has been in this country since the AIDS epidemic, so like sort of like in 1980s. And that was because people with HIV infection and AIDS didn't have access to going to they didn't want them in the grocery stores. They couldn't go to doctors. They couldn't go to dentists, anything. So there's a group of volunteers that started this thing where they would deliver healthy meals to the AIDS patients. Okay. So now there are some insurance companies covering what this is called food is medicine. So, like, if you have a chronic disease, you can get a prescription for healthy foods, like a debit card now for fruits and vegetables. Or there's a program called Veggies for Veterans, which allows them to buy fresh
Okay.
fruits and vegetables. So there are a lot of things going on in this country now since about I'd say about the 2000 or 2005, they had a White House conference on nutrition, and they decided to integrate food as medicine into this, and there's a whole effort to put it into all the agencies, this concept of food as medicine. So, because food can be medicine.
Yeah.
It's very healthy for you if you make the right choices. My company, both my real estate company and my senior company, the motto is called choose wisely. I mean, I think that's what life is all about, is choosing wisely.
Yeah. Yeah. I love that concept. You've said two things. Food is medicine. I love that idea. And wellness isn't just the absence of disease.
Right. Right.
A lot of people Again, my mother's generation, you did not go to the doctor unless you were sick, and you weren't sick unless you had a fever.
Right.
Those were the,
That's not what it's about. I mean, people that they
yeah,
get diagnosed with some serious disease and then they're dead later,
yeah,
soon
yeah,
because
yeah.
they didn't catch it early. So preventative health is very, very important for everybody, but especially for seniors. And they should. And for years, the insurers didn't want to pay for prevention. Now they understand the benefit of it.
It's like if you don't have to go to the hospital, it's not going to cost the insurance as much as if you stay well.
Right. And I hate readmissions. So, you know,
Yeah. They don't want you back in there. And, and we are so dependent upon, again, our seniors, what does Medicare cover? What can I get? And assuming Medicare covers so many things that it doesn't. And so making the right choices. And while fruits and vegetables may cost a little more than the canned version, an apple is better than a canned
but and
carrot,
it tastes
right?
so much better and has all
It
this
tastes so much
fiber in it
better.
that really helps you out.
Yeah.
So, yeah, I think it's really important.
Well, if you could say one thing that we missed, did I miss asking you a question, or is there something else that you wanted to make a point of to make sure we get across to anybody that might be listening today?
No, I think when we talk about healthy aging, I think the whole thing for healthy aging is that we maintain the functional abilities of the seniors. So whatever that functional ability is, walking, I don't know, exercising, socializing, eating, all of the functional abilities are very important to maintain, to improve and maintain. One of the things we didn't talk a lot about was about weight loss. Like, you know, we, we may be, you had mentioned some word, and I thought, well, that's, that we're eating a lot or eating well, but that we're probably one of the most obese nations in the
Yeah.
country, in the world. I mean, isn't that
Yeah.
amazing to you? The most
Yeah.
obese nation. I think I said mentioned before, like 40%. Now it's down to something like 38% of adults because they've been taking Ozempic. Those injections to lose weight, which I don't think they have issues of themselves. They could just, I don't know. I used to study all these weight loss methods that people have, and over the years, there have been this crazy amount of weight loss methods. They used to wire people's jaws. They used to,
Well, that's
they
that
still
diet
do.
culture. It's the diet
Oh
culture.
my gosh. But
I mean,
do you
I've lived through
remember
it. I've lived through so many of
yeah,
those things. And it's about, again, you were talking about your grandkids that are developing good habits early. In the 70s, that's when processed food came out. So that we didn't know, parents didn't necessarily know that all that processed food was bad. It was just that it was convenient.
it's
And
convenient,
that's what,
available. I'll give you a
and
story
cheap.
about Crisco real quickly. So Crisco was
My mom
developed.
loved
You
Crisco.
know about Crisco? Oh my God.
Yeah.
I said to my sister, it's amazing we're alive. My mother used to serve us like liver cooked in Crisco shortening on melamine plates. I mean, seriously,
Yeah.
it's
Wonder we're alive at all. My
right,
mother
right,
had the big can of Crisco every
right.
year. I
So
mean, she,
Crisco, okay. So Procter and
yeah,
Gamble was a company that sold soaps. That was their business.
yeah.
And they accidentally somebody discovered they could harden these oils that they were using for the soaps and it would look like lard. Do you believe this? Okay. So I don't know if they called it Crisco at the time, but they did. But they became a sponsor of a radio station, and the radio station had this contest, and the contest was like the beginnings of Truth or Consequence. If you remember that show, Truth or Consequence, where they had to guess the person that was walking. Don't ask me how. They gave them hints or whatever. They raised something like $1 million, which would be equivalent to like $34 million today. And it was all donated to this emerging organization called the American Heart Association. $34 million equivalency of, and they promoted, guess what? Crisco.
Crisco.
Don't use butter, don't use lard, don't use beef tallow, use Crisco. But Crisco was full of what are called trans isomers, this chemical conversion of the fat into a bad form that not only does it lower your good cholesterol, it raises your bad cholesterol.
So it's just
So
bad all the way around.
it's bad all the way around. Now there's a new Crisco. It's just as bad, but it's new. And people are saying, oh, new Crisco is better than oils. No, it's not better than oils. you know.
Just cook and
Yeah,
use your butter. Use butter. It's okay. Use
yes,
avocado and olive oil. It's okay.
they're good for you. I mean, it's
They're
not that
good
they're
for
just okay
you.
for you, you know. And I mean, two things. One, when you were a kid, do you remember any obese children in your school? We had one fat person. We called her Big Bertha. I mean, that was her name. Now there are so many children that are
Yeah.
obese, and they are going to become obese adults. I mean, that's
Yeah.
just what happened. Yeah,
Yeah.
yeah.
I
And the
mean,
other thing I want to mention about Japan is that they have this concept of called ikigai. That's how it's pronounced, but it's called Ikigai, and it is it's they don't have a word retirement in their Japanese language. Do you believe that? Nobody really retires. They just refined their purpose. So
I like that.
ikigai is the process of finding your purpose, changing it over the years, and maintaining having a purpose for living. And there's more people that are 100 years old in Japan than any other country. Now, that doesn't mean
Because
that it
again,
would
we're
have,
the unhealthiest. We work ourselves to death,
right.
and then
And you
we're
lose
so tired when we lose. Yeah, it's all the things that you've said, right? It's we spend the most on healthcare, we work ourselves to the bone, and we are the most
right.
unhealthy.
We don't have a purpose. We've lost our sense of purpose, like who we are and what we're supposed to do and what kind of legacy do we want to lead. And I really do believe that this senior home coach movement and what Compass is doing with their senior division is actually, I asked them, why did you call it Compass Plus? And they said, because seniors need plus, 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 plus services,
They do.
more than
They
what a
do.
regular realtor that can provide them, you know? And I think Catherine, with her senior home coach method, teaching us to broaden our perspective and embed ourselves in the senior industry, it's changed my purpose in my career
It
and
has
my
me
life.
as well. It has
Yes,
me as well. I feel very fortunate that you know, somebody called me and told me about Catherine and what she was doing. And now I've met you and so many other people around the
right,
country with this same mission, not only for ourselves, right, to
right,
make sure that I continue to live a healthy and long life, but to help those around me
right,
to do the
right,
same. I mean, it's just we both know that in 10 years there will be more people over the age of 65 than under the age of 18 for the first time in history.
right. I mean, I think Florida has over a quarter of the population over 65.
I believe that.
It's amazing. It's just amazing.
Yeah. Well, Sharon, tell people where you are and how they can find you if they have questions or need a senior home coach in Florida.
Okay.
Tell us where you are.
So I live in Daytona, but I work in Winter Park, which is right above Orlando. So I service like the whole Central Florida area, kind of Orlando and east to the coast.
Okay.
Um, I have a company called Sage Senior Advisors, which is focusing on helping people age in place. And if they can't age in place anymore, helping with downsizing or right sizing, whatever that means, and decluttering, and also with senior living options.
Perfect.
I have a Facebook account for senior service advisors, and I have a LinkedIn account for me that has both my real estate and my senior service all into one, Sharon Knapp.
Okay.
Um, I'm working on a website, but it's not done, so give you that. Yeah.
Well, that's okay. We
It'll be called Sage Senior Advisors when it gets done.
All right. So kind of keep an eye out for that. We will make
Yeah.
sure we link all of that, get your contact information into the show notes. So if you are in Central Florida and you are looking for some advice and some services or recommendations, make sure you give Sharon a call. She is
But the other
available to
thing is
help.
this, yeah. I also do virtual and phone
Okay.
consultations for people. So,
Okay.
um, and
That's beautiful.
the first hour consultation, whether it's virtual, on the phone or in person, doesn't cost anything. So,
Beautiful. Awesome.
and
All
if I
right.
find somebody in Texas and they call me up and your services, I will definitely refer them to you.
Here we are. All right. Well, Sharon, thanks again for being on the show. I think, given everybody some things to think about, what things they might want to, focus on as far as it comes to just their overall physical, but mental and social health as well.
Right. Right. Well, thank you for the opportunity. This was really enjoyable and educational for me, as I'm sure it was for you.
Good. Thank you. And thank you, folks, for tuning in to another episode of Relax, I Got This, Embracing Life After 60. Go take an inventory of that refrigerator and that pantry. See what you've got in there and vamoose the bad stuff. Vamoose. Anyway, thanks again for tuning in. Make sure you hit that like and share and subscribe button so we can continue to share the good word. And we'll see you next time on Relax, I Got This, Embracing Life After 60. Bye now.
Thanks. Bye.
Thank you for tuning in to Embracing Life After 60 with me, Robin McCoy. This podcast is produced by Jen Sariano with special thanks to the amazing team at Relax, I Got This. You can find more episodes on YouTube and wherever you listen to your favorite podcasts. If you've enjoyed this episode, please subscribe, follow, and share to help us spread the message. Until next time, keep embracing life to